we can reduce the risk of breast cancer. There are many factors which are high risk factors for breast cancer, and they are in our control. However, there are also some risk factors which are not in our control. The ones which are not in our control are being a woman, which is the biggest risk factor. Early menarche, late menopause are again high risk factors. And there are some women who have inherited a mutant or an abnormal gene from their family, which increases the risk of breast and ovarian cancer. Yes, these are the factors which are not in our control, but there are many factors which are in our control, and if we take care of that, we can reduce the risk of this disease. Now, which are these factors? First of all, breastfeeding the child. It's extremely important to breastfeed the child for at least 1 year. And there have been umpteen number of studies which have shown that women who breastfeed their child for 1 year or more have reduced risk of this disease. I would urge all the women to breastfeed your child, encourage women to breastfeed them, and all the offices where the women work, make appropriate arrangements so that women have place and opportunity to breastfeed their children while they are at work. Second, when the first child occurs after the age of 30 years, again, that increases the risk of this disease. Obesity. Obesity is a big disease that we are all confronting in the society today. Obesity not only causes other diseases, but also increases the risk of breast cancer. There have been umpteen number of studies which have shown that women who are physically fit have 50% reduction in the chances of getting breast cancer. And women who have already been treated for breast cancer, if they keep themselves physically fit, there is reduction in the risk of the disease relapsing in them. So women, keep yourself fit, keep some exercise regime every day and make it a part of your lifestyle. Simple walking, 4 kilometers in 40 minutes will help, or any kind of exercise which appeals to you. Please make it a part of your life. Another risk factor is smoking and alcohol consumption. Smoking certainly is a big no, and alcohol, I would recommend that keep it limited. Alcohol again can increase the risk of breast cancer. So women, there is a message that I would like to give you. Eat healthy. It's important that you eat right. Choose natural food. Choose freshly cooked food. Do not indulge in fast food and ready-to-eat food. Add more vegetables and fruits in your diet. Exercise regularly. Keep at least 1 hour of yourself for exercising. Breastfeed your children for at least 1 year and have a baby before the age of 30 years. Smoking, no for smoking, and limit alcohol. These are the factors with which we can reduce the risk of breast cancer. But however, we cannot make the risk zero. So it's also important to know how to detect the disease early. That is again extremely important. For that, I would recommend that all women 20 years and above practice breast self-examination once in a month. And all that it takes is less than 5 minutes, which you need to spare in the month. And all the women who are 40 years and above, I would recommend do a mammogram once in a year. Whenever there is any doubt, if you have any pain in the breast, any lump in the breast, any nipple discharge, or any kind of skin changes, do not hide it. Do not feel shy. Do not feel restricted to share this with your doctor. The doctors are always available to help you, support you, and get yourself completely doubt to be cleared. So take care of yourself. Health is your responsibility, and I wish you all good luck. Thank you very much.